Welcome to your podcast and PowerPoint on the examination of balance and muscle tone. This podcast is for you to use prior to coming to lab so that you can use your time in lab to actively practice these psychomotor pieces. So within the PowerPoint, you will get an overview of how to perform an examination of balance. You'll have some specific talking points for that, and then you'll watch video of balance assessments being performed with both adult and pediatric patients. You'll move then on to tone, where you'll have some specific talking points to tone on procedures related to that, and then watch video on pediatric patients undergoing an examination of lower extremity tone. We will begin with examination of balance. I'm going to provide you a quick overview now of the types of balance you will be assessing this semester, and then as you move through the podcast and PowerPoint, you'll get more specific information on each type of balance you will be assessing. So balance is basically divided into two main categories, static or dynamic. In the static balance category, the patient is going to be maintaining that position or that balance, and you will be timing them under different conditions, but the patient is static in a static balance assessment. Dynamic balance assessment, the patient is moving. So there are two types of dynamic balance assessments. One is dynamic anticipatory and one is dynamic reactive balance. In dynamic anticipatory, the patient has self-initiated movement, so they move themselves. They're moving their head or their trunk or their extremities. As opposed to in dynamic reactive balance, the patient is moving in response to an externally applied stimulus or perturbation from the therapist. Next, we'll talk through some talking points as it pertains to safety while performing a balance assessment. So if you think about why you've selected this specific test and measure, why are you looking at the patient's balance? You're looking at it because you think that there could be an issue or a concern. You've seen something, they've told you something pertaining to their balance being impaired. So having said that, you need to always remain close to your patient at any point during a balance assessment. As soon as you begin talking to your patient, you should be in close proximity to that patient in the event that they start to lose their balance, which you suspect is impaired. So you'll be close to them during communication, during any transitions. That means not turning your back on your patient to reach for materials or walking away from them unless you know you've placed them in a safe resting position. You want to guard your patient at all times with both hands, so that means that as we move through static balance assessment, you need to have good operation of the stopwatch while you're also guarding your patient with both hands. You should always have a gait belt on your patient. That should be one of the first orders of business when you begin an examination of balance, putting the gait belt on the patient, explaining what it is for. You need to always have safe footwear on as the therapist, so sneakers, something that has a solid sole on the bottom that's not going to slip off. And then the same goes for your patient. So they should either be barefoot or they should be in socks with shoes or sneakers. Socks alone creates a dangerous situation on the carpet because it can get a bit slippy. Once you've explained the examination that you'd like to do with your patient pertaining to balance, you've told them the logistics of the test, what you're going to do, and then the functional rationale why you want to look at balance. You need to make sure that before you begin the test that your patient is in their most optimal alignment. So in lab, we've talked about and will continue to talk about what optimal alignment is across the various developmental positions. You need to do your best to get your patient in that alignment before they begin their balance assessment. It would be quite challenging if a patient was not aligned well to then be able to move through that misaligned posture through their base of support for some of the balance examination items. So make sure that your patient is in their best optimal alignment. And you'll likely need to revisit this throughout the test. So patients will compensate for lack of balance or lack of range or lack of strength orthopedic conditions, they will compensate and change their base of support, change their position. So you need to keep a close eye on that, because likely you will need to go back to this alignment piece throughout the test to make sure that they remain in the most upright position. Next, we'll move into how you actually perform an examination of static balance. You're going to select a developmental position that is functionally appropriate and relevant for that patient. So perhaps they're struggling in sitting, maybe it's standing, could be tall kneel, could be quadruped. You'll know from your functional observation and from what the patient has told you what developmental positions that you should assess balance in. So you'll select the developmental position and you'll make sure that your patient is optimally aligned in that position. What you'll do after that is you'll start moving through the various conditions for static balance, looking to see if the patient can maintain their balance under these different conditions. So you're going to test with eyes opened, with eyes closed. You're going to progressively narrow their base of support in that position, and then you're going to alter their somatosensory input underneath their surface. So if they're sitting, you may place that under their pelvis. If they're standing, it may go under their feet, but you need to alter the compliance of the surface that they are weight bearing on and where their base of support is. You'll time each condition for 30 seconds. You'll see in the video clips that follow that I only timed each condition for a couple seconds for the purpose of being able to move through the video clip rather quickly, but you'll time patients for up to 30 seconds under each condition. You're going to stop the timer prior to 30 seconds if you see that the patient is struggling to maintain their balance. So that can look like a lot of different things. They may take a step or reorganize their base of support. You may have to provide them assistance to maintain that position. They might be excessively swaying or have excessive ankle strategies or hip strategies, or if they're violating the testing condition. So an example of that would be if they open their eyes under a closed eyes condition, then you would stop the test and restart. Remember that during the test, you always have to be guarding your patient, so you'll have one hand holding the stopwatch, but that hand also needs to be actively guarding your patient. The next few slides will take you through some clips of both an adult assessment and then a pediatric assessment. So you'll see the differences between the two. The adult is far more pristine because the adult is able to follow directions and has balance more in line with what is being asked as compared to the child. So you'll see some compensations, and we can talk about that in class with the pediatric patient. Okay, so today we're going to do a test that looks at how you maintain your balance in a seated position. I'm going to give you instructions about how we're going to do this as we move through. But the reason we're looking at doing this test is that you told me you were having some trouble while sitting, reaching forward at your desk or at the dinner table. So we'll take a look at this test to see if perhaps some of those problems are contributed by this balance impairment. So I'm going to put this gait belt on you first before I provide you with any further instruction. This is going to give me a safe place to grab onto you if you should start to lose your balance. Okay. I'm just going to snug it up a bit. Okay, so as I said, we're gonna do this test in sitting, and what it's going to involve is different conditions. So sometimes you have your eyes open, sometimes your eyes will be closed. We're going to change the base of support or where your feet are aligned underneath you. We'll use a different surface at some point, so you'll be sitting on one of these blue foams. And then we'll proceed through the test. We're going to time each criteria for 30 seconds, so I'll let you know when it's time. For purposes of this film, we're going to move through that process quickly, so you'll hear me say time within a second or two. Do you have any questions about the logistics of the test?
No.
Okay, is it okay if we proceed?
Yep.
Okay, so what I'd like you to do, I'm going to have you scoot back just a smidge if you're able to so that your legs are a bit more supported. And we want a pretty upright posture, so just sit up nice and tall. with your hands, I don't really want you pushing into the surface to get more stability, so if you could just have them kind of relax on your lap, that would work out good. Okay, feel okay? Okay, so I'm just gonna move a little bit close to you. I'm gonna have one hand behind you, but I'm not gonna be touching you unless you need assistance if you start to lose your balance, okay? My other hand's gonna be in front of you and we're gonna do the timing. Okay. So we're just going to look straight ahead, eyes open, and go. In time, and go ahead and close your eyes. In time, open back up. Good. Okay, could you put your feet together so that they touch? Good. Sit up nice and tall. Okay, in time. And repeat with your eyes closed. Good, in time. Go ahead and open up. For this next one, you're gonna cross your legs, and before you do so, I just want you to take a look at me. So you're gonna cross your leg, but then you have to scoot up so that this part of your fanny isn't on the surface, because we're trying to narrow your base of support and what is supported through the mat. Okay. Okay, so either leg is first is fine. And then just come over towards me. Good. Okay. Time and eyes closed. And go ahead and open your eyes and go ahead, uncross your legs. We're gonna repeat that to the other side. Time, and eyes closed. Good, okay, go ahead and uncross your legs. You feeling okay? Yep. Okay, so the next part of this test, okay, so Lisa, the next part of this test involves that I put this blue foam underneath you. So when I say we're gonna stand up, I'll slide the foam underneath, and then you're gonna sit back down on it, and then we'll worry about repositioning you so that you're in a nice, good alignment before we start. Okay, any questions?
Nope.
Okay, so go ahead and stand up. Okay, and the blue foam is back there. You can have a seat. Okay, so let me have you scoot back just a little bit if you're able to. I'm gonna move the foam with you. Okay, so that your legs are a bit more supported. Okay, and then place your feet shoulder width apart and sit up nice and tall. And then again, your hands are gonna rest comfortably on your lap. You feel okay?
Yep.
All right, so we'll start this first one, and we'll hold the position for 30 seconds. So you're just looking straight ahead. Okay, good. Any problems?
No.
Okay, we'll repeat this with your eyes closed.
Okay.
Okay, and go ahead and open. And now if you could put your feet close together so that they're touching. Good. And we'll call that 30 seconds. And then repeat this with your eyes closed. Good, and go ahead and open. How you feeling?
Okay.
Okay, so if we continue to follow the same process, the next criteria is that you're going to cross your legs over and then scoot up on the side so that there's a space between the foam and your bottom. Okay. Okay. Good. And eyes closed. Okay, go ahead and uncross, and we'll repeat that with the other leg. And eyes closed. Eyes opened. Okay, good. Feeling okay?
Yep.
Okay. This is an assessment of static balance in sitting. So Jada, today what I'm gonna do is test your balance. You were telling me that you're sometimes having trouble keeping your balance while you're sitting in your classroom listening to your teacher. So today we're going to do several things that will help me get an idea of if balance is a concern for you and what we could maybe do about that in treatment. So I will explain everything that we're going to do, but first I'm going to put this gait belt on you. This is a belt that will help keep you safe. So if you start to lose your balance, I have someplace really safe and secure that I can grab onto this and keep you from falling, okay? So could you just put your arms up for me? just gonna tuck, you can put your arms down, we're just gonna tuck the rest of that back here for you, so it's not hanging out. Okay, so this is nice and safe. If you lose your balance, I can grab a hold of you right here, okay? But for the test, I'm not gonna hold this belt at all. It's only if you get in trouble, okay? So we're gonna do a few things here today. We're gonna change positions of your legs. We're gonna do some eyes open, some eyes closed. We'll hold each for 30 seconds, okay? And then I'll let you know when that time is up. I'm gonna be timing you with my stopwatch. And that's really it, okay? If at any time you feel uncomfortable or you need to stop, just let me know and we can pause the test, okay? Is it okay if we keep going with this? Okay. Okay, so for the first part of this test, all you're gonna need to do is sit there like you have been. So we're gonna get your feet in a nice position. You're sitting up nice and tall. Can you put your hands up in your lap like this? Because I don't want you to use them to push for balance or security, okay? So just keep your hands in a nice relaxed position like this. I'm going to take my stopwatch and I'm just going to be guarding you around like this. So the first thing you're going to do is just sit here for 30 seconds. Okay, pause. We're going to say that was 30 seconds so that we can move through this quickly for the purpose of the demonstration here. So now I want you to do the same thing with your eyes closed. Close. Good, 30 seconds. Open up. Now, can you put your feet together so that they're touching? Good, and make sure you're still sitting up nice and tall. Take a look. Good, and let's go. And stop. Good, same thing now, eyes closed. Good, and stop. Okay, go ahead and open up. For this part, what I want you to do, and I'm gonna put my arm around you so you're safe while we're sitting here, I want you to cross your legs over. But, hang on one second, but what's really tricky about this is that you have to make sure that this butt cheek is off the mat. So you're gonna be up like this. Okay, do you understand? Mm-hmm. Okay, so go ahead and try and get in that position. Okay. Put your hands back in your lap the way they were. Very good. Okay, hang on one second. Let me get my stopwatch. Okay, keep your head straight. Okay, I'm letting go. Go. Good, and now eyes closed. Good, and go ahead and uncross. So it's okay for you to assist the patient into the position, but before you start your test, you have to make sure that your hands have been removed off the patient so that you get a clean assessment of their balance. Now we're going to do the same thing on your other side. So go ahead and cross your legs, and let's fix this foot down here. Good, and look straight ahead. Okay, ready, let's go. And stop. Okay, straighten your head up, straighten your head up. Good, now close your eyes. And we'll say that was 30 seconds and stop. Good, go ahead and uncross. How'd that feel? Good? Okay, so that's the first part of our balance test. The second part of our balance test requires that we put this blue foam underneath your bottom. So go ahead and take a feel. So it's just a blue foam. And we're gonna do all of these same things again, but you're gonna be sitting on this blue foam. Okay, can you go ahead and stand up for me? Okay, then let's have a seat. Okay, can you scoot back a little bit so you're more supported? Good. Okay, so now, let's see, up nice and tall. Now I'm gonna need to lower this mat table because I wanna make sure that her hips and knees remain at 90 degrees, okay? Okay, so I needed to use a stool under Giada's feet because I'm still trying to keep the angle at her hip and her knee at 90 degrees. So I was able to achieve that through this setup. Okay, so now you're sitting on this smushy kind of foam, so we're gonna do the same exact thing, okay? So we gotta move your legs in just a little bit. Okay, ready and go. Good, and eyes closed. Good, and open up. Now you're gonna put your feet together and sit up nice and tall for me, kiddo. All right, we're gonna do the same thing. Eyes open. Good, and eyes closed. Good, go ahead and open. For this one, remember the one where we crossed your legs to get your tush up off the mat? So we're gonna do that same thing. And then just come on over here. But we wanna make sure that this foot stays here. All right, you got your balance?
Yeah.
I don't know that you do. Okay, try again. Okay, look straight at the camera. Eyes open and eyes closed. Good. Go ahead and open. Uncross. And we'll do the other side. Other side. Okay. Good. Eyes open and eyes closed. Okay, uncross. Okay, scoot back on the mat. Now I wasn't real happy with that second test. Her legs weren't really supported on the blue mat, so what I would do is retest that. So I would ask her to cross her legs again so that she's more supported, and get that tush up and look straight ahead, and then I would retest that scenario. Okay, go ahead and uncross. You might have a rationale why you put this blue foam under the feet as well, so I could ask her to stand up, remove this and put it under her feet, and then reassess that if you had a functional rationale, or if the patient was struggling in a scenario where they needed to be seated with a compliant surface under their feet. And this concludes the static balance assessment completed in sitting. Test in sitting, we're going to repeat that same test with a few variations up and standing. Okay, so static balance and standing. And the reason we're going to take a look at this is that you told me that sometimes when you're in line at the grocery store, that sometimes you feel like a little dizzy or you're losing your balance. So we'll check that out in standing. So we're still going to use those same conditions: eyes opened, eyes closed, and then a different surface under your feet with that blue foam. Okay. Do you have any questions?
No.
Is it okay if we proceed?
Yep.
Okay. We're going to stand up in just a second, and we're going to step forward to the other side of that blue foam, so you won't be standing on that just yet.
Okay.
Okay? All right, so when you're ready, you go ahead and stand up. Good. And take a few steps forward. Okay, I'm just going to scoot this out of our way. Okay, so just have your feet shoulder width apart. That looks good. Stand up nice and tall, and your hands are just relaxed as they are by your side. You ready to start the test?
Mm-hmm.
Okay. Good, and eyes closed. Good, eyes open. Okay. Put your feet together, please, so that they're touching. All right, eyes opened. Stop that, and then eyes closed. Good, go ahead and open your eyes. You feeling okay?
Yep.
Need to take a break?
No, I'm okay.
Okay, so for this next criteria, you're going to slide your right foot in front of, right next to your left foot just a little bit, so it's about halfway up. Good. All right, and we'll repeat with eyes open. And go ahead and close your eyes. And open your eyes again. Good, and then we'll repeat that on the other side. Eyes opened. And eyes closed. Good. Okay, go ahead and open your eyes. Okay. For this next one, you're going to take your right foot and place it all the way in front of your left foot so that your heel is touching your toe. Okay, eyes opened. Okay, and now eyes closed. Good. Go ahead and open your eyes. And we'll repeat that with the other foot in front. Good?
Yep.
Okay. All right, eyes opened. And then eyes closed. And go ahead and open. Okay. All right, go back to a nice resting position. Would you like to take a break?
Sure.
Okay, let's go back to the mat table. Okay, so the next piece to this is narrowing your base of support even further, so you'll be standing up on one leg. If you need help getting into that position, let me know. You can put your hands on my shoulders and then let go as you're ready to start the actual test.
Okay.
Okay, you ready to go? All right. Okay, so you're going to put all your weight onto your left side and lift your right. Good. Okay, and go ahead and put it back down. And we're going to repeat that with your eyes closed.
Okay.
Good, stop. Okay, same thing over on this side. So eyes open first. Good, and put your foot back down. And we'll repeat that with your eyes closed. Okay. So you're going to put all your weight onto your right foot and raise your left foot off the ground. Good, and come back to a standing position. And then when you're ready, you're going to repeat that. Have your left leg come off the ground, and then you're going to close your eyes. Good. Stop. Okay, Lisa, so the next part of this test involves us repeating those same conditions while you're standing on the blue foam.
Okay.
Okay, so I'll give you instructions as we move through, and I'm just going to give you a little bit of assistance to get up onto the blue foam. Okay. Do you feel okay?
Yep.
Okay, so the first condition is feet shoulder width apart as they are and with your eyes open. Good, and now go ahead and close your eyes. Good, go ahead and open. Okay, so now your feet are going to touch together. And we'll do eyes open. Good, and now eyes closed. Okay. All right, how you feel?
Okay.
Okay. Any need for a break?
No, I'm okay.
Okay, so this next condition, if you remember, is just sliding your right foot up a bit, like halfway. Good. We're gonna do eyes open. Okay, and now eyes closed. Okay, go ahead and open. And then we'll repeat that on the other side. Okay, eyes open. Okay, and now eyes closed. Okay. All right. Why don't you go ahead and step off for this next one.
Okay.
And take a seat. Okay. I'm going to step away from you and demo this because I know that your static balance and sitting is within normal limits. So for this next one, you're going to stand in tandem with one foot touching the other, but we're going to change the direction and we're going to be on a diagonal so that your feet are both well supported on the blue foam.
Okay.
Okay. Okay, whenever you're ready. Okay, feel okay?
Yeah.
Okay, we're gonna do eyes open.
I'm gonna stop you.